The joint United Nations program on HIV-AIDS released a report on the HIV situation in the world and how the COVID-19 pandemic is affecting HIV response. The UNAIDS admits the global HIV targets for 2020 will not be reached. The report says 38 million people around the world are living with HIV as of 2019. And to tell us more about the report, joining us right now live from Bangkok, Thailand, is Eamonn Murphy. He is the UNAIDS Regional Director for Asia and the Pacific. Good morning, Eamonn. Glad you could join us today. About this report, could you take us through the main points of it and how far behind is the world in preventing new HIV infections?
Thanks, Ria. Thanks very much for your interest and the questions. It is really concerning that at this stage we are still so far behind. 38 million people living with HIV, 1.7 million new infections last year alone, 690,000 people died, and more than 12.6 million people still in need of access to antiretroviral treatment. This should be easily available. But we're seeing rising new infections in parts of the world. We've had some very good success in East and Southern Africa, but we've got a 72% increase in Eastern Europe and Central Asia, 22% in the Middle East and North Africa, and 21% in Latin America and the Caribbean. So you can see that the progress is mixed. It's fueled by inequalities, it's fueled by a lack of political commitment, and increasingly we are seeing laws that are being put in place that are creating even greater barriers for access to services and pushing people away from services. So this needs to change. We need renewed efforts, or else we're going to continue to see rising new infections and we're going to be even further off target globally.
Right. Well, certainly something that threw a wrench, and that was the COVID-19 pandemic. How has COVID-19 hampered the response for the needs of HIV/AIDS patients? What exactly are the challenges now?
Well, COVID-19 is threatening to blow us completely off course. It's going to potentially push back all the successes that have been achieved. It's about the access, and it's going to create barriers to access to those people who are already on treatment, and that is critical that they maintain their treatment so that they improve their own health, but then it stops further transmission to other people. Particularly the lockdowns, and this is a challenge of the fast pace of response to COVID-19, but the lockdowns have prevented access to services, increased stigma and discrimination, and in some places the key populations at risk of HIV have been scapegoated for no reason as vectors for COVID-19. So it's a real concern that COVID-19 efforts are actually creating an impact and pushing up new infections for HIV.
Well, I want to zero in on the Philippines for a moment. In 2019, an estimated 97,000 people were living with HIV in the country. 16,000 of those were actually new infections. And we're seeing that infection is high among young people. We're talking about the 15 to 24-year-old age bracket. Why is this so? Why is almost half of new infections in the Philippines within that age range?
What we're seeing, Ria, is across Asia and the Pacific, not just in the Philippines, rising new infections. More than a quarter of new infections are amongst the young in the age range of 15 to 24. We're seeing new epidemics. And in the Philippines, we're seeing this second wave type epidemic, particularly targeting young men who have sex with men and transgender. And this is about the age of a disconnect between the older epidemics, but it's also about new modes of connection. People are active on social media for all aspects of their lives, and so they are meeting socially and it's much easier to meet. So this is why the services need to change and adapt to the modern world and use the social media itself to reach to young people who don't come into government services, don't come into the traditional services, and they're living their lives in the bubble of social media and the internet, and that's how they socialize, and this is where the risks are. There are other new variables that come into play, but there are also new innovations in how to respond. And the Philippines has introduced PrEP, which is pre-exposure prophylaxis, which is using medicines to help build up a resistance to the virus. And this is critical that it's out there and easily available. And that's where COVID impacts. If it stops programs of prevention, we see rising new infections. But the young are sexually more active, they're more dynamic in the way they live. And so this is creating a new generation of people at risk to HIV.
That being the case, what can be done in the Philippines? Because we've seen some of our Southeast Asian neighbors like Thailand and Cambodia and Vietnam actually being able to reduce the number of new infections in their countries. What can we learn from them? What can we do here in the Philippines?
It needs, firstly, strong political commitment and programmatic commitment. The second part of that is the laws. What are the barriers that are keeping people away? Stigma and discrimination. We, as all members of society, need to protect our families, regardless of their sexual orientation or their sexual lives. We need to be able to make sure that we've got in place the right programs. And as I said, now it's got to be innovative. It's got to be online. It's got to be where the young people are. We can't rely on the old-fashioned pamphlets and come in for a counselling session. There are countries, and in the Philippines, there are groups like Love Yourself, and there are others who are innovating. There are ways of getting the medicines delivered by courier. In Thailand, they're even using the post to make sure people aren't affected by COVID-19. But online counselling, online testing, I send the kit home to you. We do it over the internet so you can test yourself, and then we help you access the services. But pre-exposure prophylaxis, this is critical that we get these medicines out to young people who are sexually active. And in some countries like the Philippines, where condom access is difficult, PrEP is a major success. We've seen it in Australia, Thailand, Vietnam. The countries you mentioned are rolling this out. And this is why the Philippines has started and actually is quite innovative compared to some other countries, using pharmacies so people can access it easily and anonymously, so they protect their identities if they're concerned about stigma. But it's the scale. We need a lot more effort to get it to higher numbers of people and quicker. That's the critical issue, the scale and the pace.
All right, thank you so much for pointing all those things out to us, Eamonn Murphy of UNAIDS. We appreciate your time.